I think this is a very important topic because it's something that we see often as a neurologist, because headache occurs very frequently, and sometimes this headache can be accompanied with visual symptoms. And the first disorder that we think about when we think about headache and visual symptoms is migraine. The migraine occurs very frequently, and about 1/3 of the migraine patients has migraine with aura. And aura is focal neurological symptoms, and most often these are visual in nature. So when a patient has migraine with aura, there's very high chance that they have visual symptoms. Well, this is not a life-threatening disorder, but it is very important to recognize, also because there are subtypes which can be life-threatening, and because there are cases in which headache and visual symptoms occur together, which you need to act very quickly, because otherwise it can lead to death even, or a high disability for a longer time. So if it's very clear that it's migraine with aura, then there's no additional workup necessary. But if there is any doubt, and doubt can be because there are red flags that can point you towards there's something else going on, then it can be necessary to do additional workup. And this initial workup is usually imaging, because this can help us a lot. And imaging can be done with MRI, preferably. If not possible, then with CT. But it's very important that you also visualize the vessels, so with a CTA or CTV. And if necessary, also stroke protocol, because the stroke is still in the workup, then you need to make sure you catch it. So that is why the most important part. But we should also not forget an EEG if we think about epilepsy. And it's also very important, if there are visual symptoms, to do an ophthalmological workup, because we as neurologists see things and miss things that an ophthalmologist would not. So it's very important to combine those if you have doubts about what's going on. So there are several red flags that you should watch out for. One of them is if there are new neurological deficits that you can't explain. Another important red flag is if the patient, for instance, is older than 50 years, then you really have to think about why is the migraine happening now. Also, when there is a new headache that was not there before and abruptly started, that's a reason to keep thinking. Or if the headache is, for instance, progressive, or if the patient has a neoplasm in the history, or is known to have a systemic disorder, all of this together can lead to need for additional testing. And it's very important as a neurologist to know these red flags and to be able to act on them. When we talk about visual symptoms, it's also very important to realize what kind of visual symptoms we're talking about. So if they are positive, it means that there's something happening that's normally not happening. And if they're negative, it means that you lose something. For instance, that you lose your vision. And whether the symptoms are positive or negative can help you in your differential diagnosis. Similarly, if the symptom onset is abruptly and it's maximum right at the start, that tells you something. It's different than when the symptoms occur gradually. If they occur gradually, for instance, and they are positive phenomenon, the fact that it's migraine with aura is much higher. If they are there gradually, but they are negative, the chance of it being an ophthalmological problem are much higher. And this way you can find the right diagnosis by really asking your patient what they're seeing and what's happening. So as we mentioned, seizures, for instance, can also cause this, but there are also a lot of ophthalmological disorders that can lead to headache and visual symptoms, which is why it can be important to consult an ophthalmologist. But there are also psychiatric disorders that can lead to this phenotype. So there's like a very broad range, and even systemic disorders, for instance, hypoglycemia, can lead to this. So there's a lot that can cause these complaints.